Corinna Cohn, representing Gender Care Consumer Advocacy Network. Welcome to committee, and you're the final witness, so I imagine we'll still have some questions, but please, thank you.
Chair Manchester, Vice Chair Corinna, and Ranking Member Dennison, and the stalwart members of the committee, thank you for your patience and time today. My name is Corinna Cohn. I'm a transsexual. I recently wrote an op-ed in the Washington Post that reflects on what I wish that I had known when I was a 19-year-old who had a sex change. I'm here to represent the Gender Care Consumer Advocacy Network, which is a nonpartisan patient rights registered here in Ohio. Our mission is to empower recipients of gender transition-related care to become healthy and whole. Over the past several years, state legislatures across the United States have introduced bills in response to what is essentially an unregulated and experimental medical practice of chemically and surgically altering healthy children to assume or emulate the sexual characteristics of the opposite sex. In fact, in 2020, GCCAN opposed Ohio HB 513, which would have criminalized the provision of gender care services to minors, because at the time, GCCAN, we urged Ohio to instead empower gender care consumers who currently find it difficult to bring malpractice actions against providers who have come to see themselves as immune to repercussion. And we are glad to see that HB 454 takes an approach which enhances the rights of patients rather than criminalizing medical providers. Legislators in Ohio should understand two sets of developments that have occurred in the past year. The first is that American gender clinicians have broken their silence and have started to express concerns about the lack of safeguarding and proper qualification of patients before being prescribed experimental procedures. Psychologists Laura Edward-Leeper and Erica Anderson, who herself is a transgender and former president of the US PATH, they co-wrote an opinion piece in the Washington Post titled, "The Mental Health Establishment is Failing Trans Kids," which identifies the lack of evidence-based care and the gaps of research which would justify medical and surgical approaches to curing gender identity disorders in children. The second development is the clarity that outright criminalization and bans are a losing strategy for protecting vulnerable children and their families. These families have sought out professional advice from therapists, social workers, and doctors, who in turn often must look to their professional associations for advice on providing care. Attempts by legislators to terminate ongoing care, particularly when the providers are able to provide credible arguments for the necessity of the care, will be ultimately resolved in the court system, and it'll be litigated by well-funded advocacy groups. GCCAN supports HB 454 because it takes a better approach to regulating gender care services to minors. As HB 454 lays out in section 3129.01, gender-affirming medicines and procedures produce risk for the patient. Minors cannot consent to these practices, and so it falls on the parents to consent on behalf of the children, based on professional guidance. As of now, the child carries the entire burden of risk, and even if the child is harmed due to well-known side effects of hormone treatments or is injured in the course of surgery, that child has no recourse to be made whole. HB 454 addresses this inequality through section 3129.08, which permits an individual to obtain relief for having been medicalized as a minor from 20 years past the age of majority. This provision will grant relief for minors who, after adolescence, come to regret having their gender dysphoria treated medically. In turn, it will also cause doctors and surgeons to be more circumspect in their prescriptions for medical interventions. There are two amendments GCCAN recommends making to section 3129.08a, which declares that any provision of gender transition procedures to minors should be subject to disciplinary review under unprofessional misconduct. Although the current landscape of transgender medical services is mostly unregulated, and that the standards of care lack scientific or medical rigor, and that even the meager standards of care are generally disregarded by gender clinicians, we are optimistic that this situation can and must improve, and we believe that if the gender transition industry begins to assume more of the risk for its prescriptions, that better standards and practices will emerge. We would like to keep the door open for the possibility that rigorous diagnostic criteria will be developed that may justify medical procedures in extraordinary cases. The second amendment we suggest would be a requirement for physicians, mental health care providers, and other medical care professionals that would mandate an annual report to the Ohio Department of Health, the number, age, and sex of minor patients who are receiving gender transition services of any type. It is in the state's interest to monitor this demographic information and is invaluable to public health researchers. Thank you for listening to my testimony. We are firmly in favor of the legislation that improves patients' rights and which shifts more responsibility and risk onto healthcare providers. And we see HB 454 as a model for national reform.
Thank you very much for your testimony today. Are there any questions for the witness? Representative Smith?
Thank you. Through the chair to the witness, thank you for being here. I would like to ask you the same question I've been asking other folks
Yes.
about the mental health care piece and my concerns and worries about sort of required disclosure and how that affects a child who is outed and what kind of reaction they could have in their home. I'd love to hear your thoughts about that, please, if you don't mind.
Through the chair to the member, thank you for asking that question. We understand that there are two things that are happening. One is that there is not enough mental health care being provided to any of these young people who identify as trans before they are ushered through medicalization. There should be. In some cases, there are. It might be that some of the clinicians here are especially careful about it, but we know from our own experience, and as you've heard today, that some people can see a clinician and be prescribed the same day. So we especially underline and emphasize the importance of mental health care. But the second part of that I'm worried about is that there has been a trend over the last 10 years for affirmation only. So while there has been historical problems with conversion therapy against gays and lesbians, this phrase conversion therapy has been redefined to include trying to help young trans-identified people figure out if there are any co-related issues that they're working through for which they are trying to use transition as a cure. So to the extent that young people ought to have more mental health care, they absolutely should. If it is provisioned in such a way that these young people are not allowed to explore other traumas or co-related issues and are instead simply ushered onto a transition track, then that ultimately would be doing more harm. So we need more open exploration of how young people who are identifying as trans, why, what they expect to get from it. Do they have a realistic outlook of what that will be? Because I didn't.
Follow up?
Chair Tulis, thank you for that. And I love that we're having a nuanced discussion here, right? So that's what making good legislation is all about, or avoiding really dangerous legislation. So I just want to say that my understanding and my personal experience with lots of therapy has been that social workers and psychologists, you know, I'm speaking from personal experience, don't, as a professional, you know, standard of practice, you know, really intend to push a patient in one direction. And again, I just want to go back to this piece of, you know, this medical record that talks about this full menu of options and discussion about all the issues. This is from an earlier person who provided testimony from, I think, a friend's child's patient record. I don't know, there are no names on it. Their privacy is protected. But I just want to say that what I would agree with is that we have, you know, the highest standards of counseling provided to people, meaning that they, you know, are fully trained, you know, psychological and counseling and social work experts who are supportive of the patient and absolutely always doing trauma-informed work. And I don't know, for the record, there would never, ever be an intention, not at least from me, for a psychologist, social worker, or counselor to ever push a patient toward their own desired agenda. I don't have a question, I'm sorry.
Uh,
Are there any additional questions for the witness?
Could I, Chair,
Yes,
may
if
I
you would like
respond
to,
that?
yes, sure, if you'd like to respond.
I'm going to assume a question there, because you said something that made me laugh, and I wanted to explain why. I am a patient of my own local gender clinic. I am turning 47 next month, and I'm starting to ask, I want to live to old age, and I'm starting to realize that I've made changes that are going to make that difficult. My gender clinic serves hundreds and hundreds of patients. They do not have an endocrinologist on staff. And I was asking, what does that mean for my health? And they weren't able to answer it. But the topic went on to talking about how I can continue to get estrogen prescriptions, because I have to see them every year if I want to have my prescription renewed. And I was told that I could go to Planned Parenthood now, and that my clinician was saying this very guarded. She was saying, well, they only have 3 hours of training, but you've been on this for so long that you're probably okay going to Planned Parenthood. But what I learned from her, and I apologize to her because I surreptitiously recorded this if you want to hear it, she told me that patients now are going out to Planned Parenthood, and they only have 3 hours of training. They don't have any training on helping these young people at all understand the huge impact that transition is going to have. And there's a new model that's coming into trans healthcare, which is called informed consent. And this is where somebody who identifies as trans, they believe, they have friends who identify as trans, they believe they are trans, they don't see a psychologist, they don't see a therapist. They go and see the Planned Parenthood trained physician who's had 3 hours of training on hormone replacement therapy. They sign a piece of paper that has what the side effects are on it, and they get a prescription. We can't do this.
Are there any additional questions for the witness? Oh, Representative Liston?
Thank you, Chairwoman. Thank you for your testimony. And I think that we all want to ensure that we are protecting the public and the consumers and those experiencing healthcare needs. Here's where I'd love to touch base a little bit, because we are talking about minors. And so I think sometimes we're conflating sort of the adult process, which obviously in many cases is undergoing change and has room for optimization. And I think that, we're always improving in healthcare. But in the pediatric setting, there's certainly already that level of requiring consent for treatment and requiring parental involvement. Physicians, no one is going to prescribe hormones or be able to prescribe hormones for a child without parental involvement at any sort of gender-appropriate clinic. And certainly anything beyond that still requires parental involvement. Whereas this law says, you know what? Parents and kids working with their doctor, we don't trust that. We need to put this law to limit the options. Again, the law is broad, so although I know everyone's thinking surgeries, the law may include, say, advice that perhaps wearing a binder for a couple of weeks would be something that the child may emotionally, may benefit their mental health state at that time. So I'm worried about and would love your thoughts on sort of this government intervention between parents, kids, and healthcare providers when we're talking about a large range of treatment options and not just extremes.
I appreciate that question. I didn't explain my political affiliation. I'm a libertarian, probably the only one around here. It pains me to come and say, we need more regulation. But from all of the stories that I hear from people who contact me and contact our group, who are either currently in transition or have been past transition, what we know is that people who are minors, who are at that pediatric level, or even who are in adolescence, which goes up to 25, they are not mature enough to understand the long-term effects of these medicines and these treatments. So to come to your point, what is the government doing in this? Well, one of the reasons why we're so enthusiastic about 454 is that it's not an outright ban. I know the language right now says that it is unprofessional behavior. That's a little bit different. What it does instead is places a lot more risk on the provider by increasing the amount of liability that they'll face if they don't follow rigorous standards of care when they choose medicalization or surgery for their patients.
Follow up?
Sorry. Now, the bill specifically prohibits any medical or provider, which includes psychiatrists, psychologists, from providing any medical or surgical care related to gender services. And that includes the things that people think about on extremes, but it also includes, as I said, and it says any social or, I'm sorry, I'm pulling up the exact language, or instill or create psychological characteristics that resemble a sex difference. So even a binder in this, a physician saying, this is something that it may be beneficial to try within your family, that's prohibited. No medical provider is able to discuss that if this bill becomes law.
Through the chair to the member, the version of the bill that I looked at did list those things as being unprofessional and not as bans. And in my testimony, one of our recommendations is that even making, that's section 312908A, our recommendation is that we wouldn't even make that unprofessional, but that we would still retain the age of majority plus 20 window so that people who feel like they weren't properly qualified would have the advantage of that extra time to figure out what has happened to them so that they can be made whole through a lawsuit.
And just follow-up statement. I think that certainly in the analysis that our LSC has given states that these are prohibited practices and not simply listed as unprofessional. But I appreciate your interest in ensuring flexibility in the space that I think we might all be more interested in having flexibility. So thank you.
And perhaps the sponsor can follow up with some clarification on that, either now or at a later time, if there is a misunderstanding as to what's included in the bill. Are there any additional questions for the witness? Representative Click?
So thank you, Chair. You read my mind. I would like to provide some clarification on that. That stuff is not, those procedures are not forbidden. Counseling is not forbidden. What is forbidden is keeping this from the parent. Saying that you own the child, you know what's better for the child, and that you can make these decisions, you can guide this child's path without their parents' consent. Parents are responsible for their own children. If a parent wants to, so we're talking about counseling, we're not talking about medicalization. If a parent supports their child socially transitioning, which would include their dress, their hair, their behavior, their pronouns, they can do that. That if the parent decides on that, what we are opposed to is the medicalization. Number one, for counseling, we're opposed to usurping the authority of a parent. That's all we oppose in the counseling realm. And the primary part of this bill is to oppose medicalizing the transition for the child, which leads to irreversible damage. Abigail Schreier has a terrific book by that title, and we want to prevent things where you cannot turn back the clock. When you are an adult, make whatever decisions you like. And if the parent and the child agree, and the counselor agrees, you can do the social stuff. but to medicalize that child, the child is not able to provide informed consent to sell away or give away their sterility, their health, all the health risks that include blood clots, strokes, cancer, early death, greater risk of suicide. We don't think that a child, and professionals have testified to that today, that as a child is able to give informed consent to those things. So I hope that clarifies it. If you find something totally different from that, and if making an amendment to that would clarify that, would help you support the bill, I'd be happy to have a conversation. So now.
Thank you for the clarification. Are there any additional questions for the witness, Representative Click?
Yes. First of all, Ms. Cohn, thank you so much for coming. I had not met you, and even till now, to your testimony, I didn't know your story, and I'm very grateful for you coming and sharing your story today. When you said you were 47, I was going to say 25, 26, so good job there. So I'm curious, at what age did you transition?
Through the chair to the member, I started social and medical transition at age 18. Started
18?
with hormone replacement therapy, and I had sex reassignment surgery at 19.
Okay, as an adult, thank you. Follow-up, Chair. And so as I follow up with this, are you familiar with Dr. Marcy Bauer?
Through the chair to the member, I am, sir.
Okay, so through the chair, so Dr. Marcy Bauer is also a transsexual as yourself and performs the surgeries and has performed well over 2,000 surgeries. And so she was also the physician that performed the surgery for Jazz Jennings, who infamously is the poster child for gender transition for youth. But she and some other doctors, and she's also the president-elect of the WPATH, the World Professional Association for Transgender Health. And she is coming to the conclusion that this should not be done on minors, from what I have seen recently, and I'd love to have your input on this. But one of the reasons, ironically, that they're coming to that conclusion is not because of the blood clots, it's not because of the strokes, it's not because of the increased risk of heart attack, and it's not because they detransition later, but it is that because as these children come to this place, and then if they never go through puberty, they will never be able to have an orgasm. And to follow through with that, I'm kind of embarrassed to say that out loud in here, but they will not be able to have a fulfilling sex life, and that's what disturbs them, and so they are backing off on those recommendations. Would you like to comment on that?
Through the chair to the member. You correctly identified that I was an adult when I had sex reassignment surgery. I was a virgin, and because of that surgery, I have never had what would be considered a...
Okay, that's fine. I wasn't trying to push you personally that far.
It's fine. I talk about this in my Washington Post article. It's just still a little bit difficult to talk about, especially with a room of my friends since we've known each other for so long now. I cannot have an orgasm with a partner from having sex, and I haven't. My understanding is that this is a disturbing thing to hear from most people, but this is probably like if you've never had
you don't miss it.
Sight, you don't miss it, right? So this is pretty common for people who are, for males who have been on puberty blockers or cross-sex hormones through a young age. I didn't even start until I was 18, but the fact is that the surgeries that they do, which are supposed to make you whole and authentic, are cosmetic in nature, and they're not a replacement for what you could have, what you would have been born with if you had been born the opposite sex. It's a substitution. And one of the things that I fear is that for a lot of these young people who are being encouraged to start social transition, pediatric transition, is that their expectations of what adult life is going to be in their new sex role is misrepresented. that for girls who believe that they're going to grow up to be men, they believe that they'll be able to have phalloplasty and have a fulfilling and enriching sex life with the penis that is constructed usually from their forearms. That's not true. They won't have that. And for the boys who want to grow up to be girls or become women, it's unlikely that they're also going to be able to have a full and complete sexual relationship with a partner. It's going to be compromised.
Are there any additional questions for the witness? Representative Glick?
One follow-up, and I'm done. And again, I want to thank you for coming. So with all of that in mind and consideration, don't you believe it's impossible for a minor at the age of 9, 10, 11, and 12, 13, where I know that they are starting this process with the hormone blockers, isn't it impossible for them to give informed consent because they have absolutely no clue what they're consenting to? Would that be accurate?
Through the chair to the member, I believe that's true.
Thank you so much for testifying today.
Representative Humphrey?
Thank you, Madam Chair. Thank you for being here. I have a real quick question. It's my last question, at least. How old were you when you started to think that you may be trans?
Through the chair to the member, I was a gender nonconforming child. I didn't have a really strong awareness of the difference between boys and girls in a social way. I was in jazzercise, which I don't regret. And it wasn't until maybe 5th or 6th grade that I realized that it was going to be inevitable that I grew up to be a man, which it's true, that is inevitable. And when puberty started, that's when I started having a severe gender dysphoria and was trying to do anything that I could so as to avoid growing up to be a man.
Are there any additional questions for the witness? Seeing none, thank you very much for your time today.
Thank you, Chair.
And thank you to all the members. I know it's been a long day, and we've had a very long and robust discussion, so I appreciate all your time. I did just want to make it clear for folks who are visiting us today, if you took pictures or video during this hearing, we do need you to fill out a form. They are on the table up front, so please make certain to do that before you leave. Is there anyone else who wishes to testify on House Bill 454? Seeing none, that concludes the second hearing on House Bill 454. Seeing no further business before the committee, we are adjourned.